you like to know. It's called chemistry.
This is parkour.
Parkour!
Ladies and gentlemen, boys and girls, step right up, step right up. Come closer, you won't believe your eyes behind this curtain.
Hi, Maddie, Ella, and the Pinkerton AP Chemistry class. My name is Dr. Gina Hand-Eoloff, and I wanted to share with you why chemistry is so important to me in my role as a doctor of nursing practice or an advanced practice nurse. So I work as a nurse practitioner every day in an internal medicine practice here in St. Louis. And I couldn't do my job literally without chemistry. So chemistry is really important in the human body. We have to understand like the sodium and potassium pump.
The sodium-potassium pump uses active transport to move molecules from a high concentration to a low concentration. The pump moves sodium ions out of the cell while moving potassium ions into the cell. This pump is powered by ATP. For each ATP that is broken down, 3 sodium ions move out and 2 potassium ions move in.
Sodium ions bind to the pump and a phosphate group from ATP attaches to the pump, causing it to change its shape. In this new shape, the pump releases the 3 sodium ions and now binds 2 potassium ions. Once the potassium ions are bound to the pump, the phosphate group detaches. This in turn causes the pump to release the 2 potassium ions into the cytoplasm.
Right now, nerve impulses are traveling throughout your body. None of these impulses would be possible without the aid of the sodium-potassium pump. The pump is a specialized type of transport protein found in your cell membranes. The cell membrane is a semi-permeable outer barrier of many cells. The pump's job is to move potassium ions into the cell while simultaneously moving sodium ions out of the cell.
The process is important for a variety of reasons. For example, in nerve cells, the sodium-potassium pump creates gradients of both sodium and potassium ions. Gradients are formed when you have an area of higher concentration next to an area of lower concentration. These gradients are then used to transmit electrical signals that travel among nerves. Without this process, your nerve cells wouldn't function.
Nerve cells aren't the only place the sodium-potassium pump is used. In fact, the function of this pump underlies most cellular processes. For example, the pump is used by your kidneys to maintain sodium and potassium balances in the body. It also plays a role in maintaining blood pressure and controls cardiac contractions. If your heartbeat is steady, thank the sodium-potassium pump.
When one little thing goes wrong, one little chemical reaction, what that can do in terms of if there's too much sodium, water follows it into the cell and the cell can explode. If there's too much potassium, you can have irregular heart rhythms and your heart can stop. Or on the other hand, if you don't have enough potassium, you can have arrhythmias, you can have muscle cramps, you can have all kinds of neurological dysfunction if the chemicals in your body and the ions aren't just correct.
Pharmacology is the study of drugs or chemicals and the effects they have on living animals. Pharmacology explains what drugs are, what they do to body functions, and what the body does to them. Pharmacology also explains why a person may experience side effects when they take drugs and why there is such a wide spectrum of differences between drug actions in different people.
A drug is a chemical that interacts with proteins in the body to affect a physiological function. This is the general idea behind all medicine. Once these chemicals are absorbed into the systemic circulation, they bind with certain proteins, and this changes the functioning of the cell slightly. No drugs are specific to interacting with just one type of cell or one type of protein, and this is what causes side effects.
In prescribing medication, so you have to understand the pharmacology behind a medication and how that medicine will impact every patient on a cellular level.
The chemical in the drug that affects physiological functioning is the active ingredient of the drug. For most drugs, the amount of chemical needed to cause an effect is very small, often as small as 5 micrograms. Most of the drugs that we take are also comprised of inactive ingredients that work to fill out the drug. Inactive ingredients are, as the name suggests, ingredients that have no effect on the functioning of cells, namely lactose, dyes, and gluten. If the drug needs to be taken orally, the inactive ingredients also work to bind the drug together and lubricate the drug so it is easy to swallow. So the inactive ingredients are the fillers, binders, and lubricants of the drug, whereas the active ingredient is the very small amount of chemicals that reacts with the body to produce an effect.
Our bodies are largely controlled by proteins. Proteins exist in many different forms in the body and have many different functions. Each protein has a specific function and is quite specific to the cell type that it acts on. Proteins also act as drug targets. In order for a drug to exert an effect, it needs to be bound to a protein. This can be thought of as a lock and key system, where the drugs are the key and the protein is the lock. Once the drug is bound in this lock and key mechanism, it can only have one or two main influences over the cell. It can produce a change in response, or it can stop a normal response to the cell. Drugs that produce a change in the cell functioning are called agonists. Drugs that stop a normal function of the cell are called antagonists.
Once the drug is bound to a protein, it exerts a therapeutic effect on the body. This is the pharmacodynamics of a drug. Drugs primarily treat cancer, contraception, pain, respiratory, obesity, and infection.
Pharmacokinetics is the study of what happens to drugs once they enter the body. The main stages of pharmacokinetics include 1. The absorption of the drug into the blood and across cell membranes to enter the cells. 2. The distribution of the drug throughout the body. 3. The metabolism or breakdown of the drug. And 4th, the exertion of the drug from the body.
Each drug will have a unique bioavailability. This is the amount of drug available to have an effect on the biological system. A drug's bioavailability is determined by its pharmacokinetics. For example, some drugs are poorly absorbed as they do not cross cell membranes as quickly or as effectively as others, and so less of the drug will pass into the systemic circulation where it needs to be in order to have an effect.
Each drug has a range of dosages that can effectively treat a condition while still remaining safe. That is, the range between the lowest dose that has a positive effect and the highest dose, before the negative effects outweigh the positive effects. This is known as a therapeutic window for drugs.
Many of the reasons that we see such a wide and diverse range of efficacies of drugs across people are that drugs work differently in different people. A drug will usually produce the same qualitative effect across individuals. That is to say that it will produce the same end result and the same side effects, but the quantity of these effects will be different. So some people may experience a shorter action of the drug or a more intense side effect.
This variation is mostly due to differences in pharmacokinetics and pharmacodynamics between ethnicity, age, genetic makeup, and disease state. There are quite substantial differences in drug metabolism between peoples of different ethnicities. Asians are usually more sensitive to most drugs than Caucasians, and Caucasians are more sensitive than Afro-Caribbeans.
The elimination of the drug from the body is directly influenced by age. Newborns and elderly experience the effects of drugs for longer, and the drug takes a lot longer to be eliminated from the body. The differences in our genes are also an important determinant of variability in what our bodies do with drugs. There are many different disease states that affect pharmacokinetics. In fact, most diseases will affect pharmacokinetics to some degree, and this is for your doctor to determine and consider when prescribing medication. Diseases of the liver and kidneys will affect drug metabolism and excretion, whereas diseases of the gastroenterological systems will affect the absorption of drugs. Receptors in the blood-brain barrier, blood, heart, and skin are just some of the other areas that, if affected by disease, can impair the therapeutic action of drugs.
Polypharmacy is the use of multiple drugs at one time for different reasons. This occurs most frequently in the elderly, who need to take many different types of drugs a day. Drugs can be affected by the pharmacodynamics and pharmacokinetics of the other drug. For example, a pharmacodynamic reaction would be if drug X works to decrease heart rate, it may affect the distribution of drug Y due to decrease in blood pressure. A pharmacokinetic reaction would be if both drugs are metabolized in the liver and therefore need to compete with the metabolizing enzymes.
The side effects associated with some medications are more detrimental than the disease state they are treating. It is in these situations when you and your doctor must work together to determine the risk and benefit profile of taking the medication. In order to completely determine the risks, you must tell your doctor which medications you are taking concomitantly, including herbal supplements, any allergies you have, and any previous adverse effects you have experienced from medication.
Make sure you are aware of all the medications you are taking, what they are for, and the risks associated with each. If the side effects are severe, you may not want to continue with this treatment. Ask your doctor if there are many alternatives, and if not, discuss the consequences of not taking the medication. However, never stop a medication without the advice of your doctor.
Developing pharmaceutical products is an extremely expensive and long process, costing billions of dollars and taking over a decade to produce one drug. There are 3 main stages in the drug development process. They are laboratory methods. This includes testing the newly formed/discovered molecule on cell cultures. These are cells in dishes in labs, not within living organisms. And then animals, which are usually either rats or mice. Clinical trials, firstly on healthy human volunteers, then moving on to patients undergoing medical treatment. Socioeconomic methods, assessment of the drug in the community, the adverse effects, the family of the patient's response, and the healthcare costs, etc.
Each stage of the process must pass strict safety testing before the medicine can progress. Throughout all stages, the scientists are determining the benefits versus risks of a new drug. For every drug, there will be side effects and adverse effects in some patients. In order to determine whether the drug will have an overall benefit, the proportion of patients that respond positively to the treatment must be compared to the number of patients that respond negatively.
So chemistry is super important to what I do every day in my role, and I hope you guys are enjoying learning all about it. Thanks for including me. Bye.